My name is Shannon Fleming. I'm a registered nurse in the state of North Carolina, and I am currently working in the case management department in a local hospital. I've been in that position since September 2018. I've recently taken part in a collegiate debate regarding North Carolina Senate Bill S309, and it's entitled Immunizing Pharmacists. And this bill would allow pharmacists to provide vaccines to anyone aged 10 years and older, flu vaccines. And it would also give them the authority to give vaccines to the vaccines that the CDC recommends for everyone. The best argument that I have found for this bill, giving pharmacists the right to immunize, is the fact that the vaccination rate will go up whenever they are able to. It's much easier to walk into a pharmacy and get a vaccine. It's much more convenient. They can go on their lunch break, go at night, go on the weekends sometimes instead of having to make an appointment to go see their primary care physician. So that's the argument for it. The best argument I have found against the bill would be they give the vaccine and the patient has a bad allergic reaction to it. I'm not sure that pharmacies would be equipped to handle that. So of course they'd have to call 911, get EMS out. So if the patient had gotten the vaccine in a doctor's office or in a hospital, they would be more equipped there to deal with emergencies like that. So the legislation is currently being re-referred to the Senate Healthcare Committee. And I am for this bill because, like I mentioned just a few seconds ago, it gives people easier access to get vaccines. They're always talking about how we want more people to get vaccinated. So by allowing pharmacists to do this, I really feel like the vaccination rate would go up, just for the ease of convenience. They can drop in at any time. It would also increase the number of people that actually get a vaccine. So more people would be going, be able to have easier access to it. And it also helped nurses ensure that their patients are being vaccinated. You can hand them the prescription, say, here's your prescription, go by your pharmacy. You can also, while you're waiting on your prescription, get your vaccinations done. So quick, easy, convenient, can go anytime, helps us keep our vaccination numbers up. So I think this bill should move forward to ensure that more people have easier access to the vaccines. And I feel like this is a change that needs to be made right away to, again, help people have better access and better resources to do that. Thank you for your time.